Hello, everybody. My name is Antonio Mendoza Ladd, and on behalf of my co-authors, I would like to thank GIE for inviting us to present our article titled Prophylactic Stenting to Decrease Incidence of Esophageal Strictures After Extensive ESD. So, as you know, ESD allows en-bloc resection of early esophageal neoplasms with low recurrence rate. However, when large resections are performed, stricture formation risk increases. In fact, when circumferential resections are done, stricture formation is almost 100% guaranteed. From a pragmatic perspective, placing a fully covered metal stent to prevent such strictures makes sense. However, the literature available on this topic is very limited. In fact, the literature comes from 3 studies in China that have used coated metal stents with polyglycolic acid to prevent stricture formation. Therefore, in this case series, we aim to report the effect of prophylactic stent placement on stricture formation after extensive esophageal ESD in the United States. So because it was a case series, there was no real protocol for it. In fact, this report came about after having casual conversations with a good number of interventional endoscopists in the country, asking them about their practices and if they had experience with this method. Very few responded positively, and the ones that did actually are the ones that are co-authors of this paper. But the minimum inclusion criteria of patients for patients to be included in the study were resection that involved at least 50% of the circumference. The stents had to be placed immediately after the resection. There were to be no utilization of any other stricture prevention method, and there had to be an endoscopy follow-up at least 3 months after the esophageal stent had been removed. The main outcome that was evaluated in the study was the incidence of a clinically significant stricture, defined as a symptomatic stricture requiring any type of therapy. Here you can see one of the cases that were included in this series. This is a circumferential squamous cell cancer of the esophagus that you can see was fully resected in a circumferential manner. The stent was placed, and then 3 or 4 months after the stent was removed, you can see there was no stricture in the esophageal lumen. So the mean age of our patients was about 70 years old. 3 of them were females. There were 5 cases of squamous cell cancer and 3 of adeno-CAs. All procedures were uneventful, with an average duration of about 200 minutes. The mean length of the neck mucosectomy was about 6 centimeters, and the mean interval from stent placement to removal was about 38 days. So this is the main table of our study. I want you to focus your attention to the fact that out of 8 patients that we included in this report, 5 of them had a fully circumferential resection, 100% of the lumen. Different kinds of stents in terms of brands and lengths were utilized to prevent strictures. There were different intervals at which they were removed. Different stent anchoring methods were used. Of note, every stent in this case was anchored in one way or the other. 2 cases of stent migration were documented, but they were both repositioned and removed successfully with any adverse events. These are the lengths of the mucosectomies with an average of about 6 centimeters, which I mentioned in the previous slide. And what I want you to notice here, even though the video is not letting you see the whole table, is the fact that 6 out of 8 patients in this series avoided a stricture with this approach. So this means 75% of patients avoided a stricture. So as you can deduct from the previous slide, 2 out of 8 patients, or 25% of them, developed a stricture in this study. Interestingly enough, both of them were females with SCC. Whether or not patient demographics or tumor histology play a role in risk formation is unknown. From revising the literature that we did when we prepared this manuscript, that we couldn't find any information in subgroup analyses or anything reporting these variables as risk factors. However, it would be interesting to investigate this in future larger studies. We believe there are four important aspects of our study that need to be highlighted. First, this is the first report that is outside of China. This is the first report in the West, basically, this including Europe and America. All the patients included in this case series had a high risk of stricture formation. The stents that we used in this study were not covered with polyglycolic acid, and all patients tolerated the stent without any problems. One of the major concerns that a good number of interventional endoscopists that we consulted had was whether or not the patient was going to tolerate the stent or was it going to be a safe approach? Was there going to be any perforations or bleeding, etc.? In our study, in our, of course, limited case series that we have, there were no major adverse events reported. So based on our results, we conclude the following. Prophylactic placement of a fully covered metal stent in the esophagus after extensive ESD is effective to prevent stricture formation. More importantly, this approach is safe and feasible. More studies are needed to focus on the effective variables like demographics, stent diameter, and tumor histology in the overall stricture risk. Thank you very much.